after testing positive for COVID-19?
Well, this is a point that we've had a lot of discussion about. At this point in time, 6 months or so into this pandemic, retesting is not really recommended. And we get a lot of calls from people whose employers want them to retest to get to a negative test. Sometimes it's other family members want them to retest to get to a negative test. But here's what we know. When you are first testing positive, they find live active virus in your nasal secretions. After you spend your 10 days in self-isolation, and if you had fever or symptoms, your fever is gone, your symptoms have at the very least, if they're not gone, they're better. You are considered to be not contagious anymore after that 10th day. What we also know is that some people who test because they've been asked to get a positive or because they think that's what they should do, they can test positive for weeks going forward, maybe even up to 12 weeks going forward. And I have talked to a number of people who've had 3, 4, 5 tests that continue to be positive after that very first positive. And they're concerned about it. Their employers don't want to let them back to work because they think they're still contagious. But what the studies have shown is that if you have that 10 days behind you and your symptoms have improved, and that your illness was only mild to moderate, not severe enough maybe to be in the hospital, but that's kind of a separate group of people, that after 10 days, whatever viral particles are found in your nasal secretions do not make you contagious. They are not able to replicate in another person to make them sick. So we're very confident, and in fact the CDC now does not recommend retesting for at least 90 days. And that is what our thought process is here. The state of Tennessee agrees that is the path we'll follow.